Hello, Dr. Kende Elisha speaking here, founder and CEO of Pmhnp Certification Academy. Today we're doing a little free review to show you how to really think through the exam, especially when it comes to diagnosis. But we have to keep in mind that there are no strategies without content. So the very first thing we must have down packed is what? Your content. If you don't know your content, how do you recognize the key symptoms, the keywords to be able to nail the right diagnosis? And let's not forget that the ADPI process applies when we are diagnosing. That is the assessment, the diagnosis, the planning, the implementation, and the evaluation. That's something you're going to hear me talk about a lot, because if we don't assess our patients correctly, guess what? We're going to misdiagnose them. When we misdiagnose them, our planning will be off. If our planning is off, what are we implementing? Nothing. So everything builds upon assessment. So we have to see each of these as a subject and deal with them just like that and have a good understanding of them. So now, what are we going to be doing today? We're going to be looking into test-taking strategies for a case. I think I will just take a case and walk you all the way down to show you how to really analyze questions, to see you what one question can potentially contain, to see you why strategy is just a gimmick, to see you why strategy may never work without content. There are no strategies without content. Absolutely not. Dr. Kende Elisha speaking here again. I'm reintroducing myself. We're now going to get started. A 25-year-old keyword, male, present with what? To the clinic with complaints of what? Not sleeping for the past 6 nights. Male is a keyword. The setting is a keyword. And that is the clinic. Listen, an ER is not a clinic. Does it make sense now? Acute care setting is not a clinic. So the setting matters. You have to know your setting to be able to understand what you're dealing with and how to understand what is in your hand. Not sleeping is a keyword. The past 6 nights is a major keyword right there. Claiming he feels great and doesn't need sleep. See? And that is a major keyword. I feel great. I don't need sleep now. So night nurses, don't start thinking that you have this issue. I'm not going to say the name, because as a night shift, I used to be a night shift nurse too. I feel tired after so many hours of not sleeping. This person is been up for 6 straight nights and is not tired. That is a problem, guys. Now, he is overly talkative, jumps from one idea to another, and describes himself as a future billionaire. Despite having no clear business plan, he maxed out his credit card, buying luxury items he cannot even afford. He has no history of substance use. Those are all keywords too. And family reveals that his mother has been diagnosed with bipolar disorder. Now, that is what stylishly introducing genetics. So which of the following is the most likely DSM-5-TR diagnosis? A, bipolar 1 disorder. B, bipolar 2 disorder. C, cyclothymic disorder. D, schizoaffective disorder. Now, let me tell you something about this question. First of all, it's thick. Thick, man. Now, let me tell you, a question like this, what do you want to do? You want to, probably, I would say maybe if it's going to take you more than a minute, go ahead and flag it and keep it moving. As you keep it moving, now you're going to see like 1-line question, 2-line question. You want to save that time and slap it on top of this one, especially if it's going to take you at least 1 minute and 30 seconds. Now, for every question, you don't have 1 minute, 30 seconds. Now, even if your question is 1 line, it is still the same grade, right? So my point is you can always save on those little tiny skinny questions and dump them on the thick questions. So in any case, let me say, ideally, you must be able to read this top for 30 seconds. You must be able to read the bottom 30 seconds. By the time we had it up together, it's going to be 1 minute. So are you able to keep up with that? If you cannot, don't forget, they have accommodation for exams. You can always apply for extra time if you need it by contacting what? ANCC or by contacting AAMP. They do have accommodations if you qualify. Not everybody get extra time, but they are very generous and fair as long as you have the reason to get extra time. So please drop your answer in the chat. What do we think here? Now, after reading your question, after reading your keywords, you're going to go back and do what? I'm going to say, okay, 25-year-old male, clinic, not sleeping the past 6 nights, feels great, doesn't sleep, overly talkative, jumps from one idea to another, future billionaire, having no clear plan, so lost. It's a different to say, okay, I'm going to be a billionaire in future. It's different to be so clueless and lost. You don't even have any plan. and there is no, it's not looking good because you don't have anything to say, okay, this person can really achieve it because of X, Y, and Z. There is no way to nail all of that. Now, he has no history of substance use, and family history reveals that his mother has been diagnosed with bipolar disorder. That's a major family history. Don't forget. I will quickly drop in some content here. We have what? Bipolar disorder. When we talk about bipolar disorder, there are types of bipolar disorder according to the DSM-5 TR diagnosis guide. We have what? Bipolar 1, bipolar 2. We have hypomania. We have cyclothamia. Now, bipolar 1 goes on for 1 week. Listen, of what? Irritable mood. What do we see? They have all these dick fasts. They can most likely, they're going to have this manic phase. This manic phase is about to set in here, or it's setting, it's getting close. They are already past 6 nights. For the past 6 nights. So in 1 more day, patient will be what? I know this one is a little vague, right? But in 1 more day, do we call it bipolar 1? Let's look at the content behind bipolar 2. With bipolar 2, we're going to call it 2 poles. What does 2 poles mean? 2 poles mean we have what? We have major depressive disorder, and we have what? Hypomania. Like, what in the world is hypomania? It's simple. Don't forget, in your mind, go ahead and sketch a graph. This graph is called a graph of life. In our life, our mood can either be up in the roof or our mood can be down in the dump. This is our life, including me, including you. Let us all be honest here. We all don't have happy days. Things happen. You just got married. You're so excited. You're going to get up to the roof. Now, when you stay glued to that roof for more than 7 days, it is something else. It is not because you just got married. We're going to call it what it is. We're going to call it bipolar 1, period. Right? Now, when something terrible happened to you and you are down in the dump, looking all sad and teary, you know, and it just feels so down, and you're hanging out here for 2 weeks, guess what we call that? We call that MDD. We call it what it is. And that goes with what? Sig caps. Like, what in the world is Sig caps? It's just a mnemonic. You can come up with your mnemonic. Sleeplessness, interest loss, psychomotor agitation or retardation, guilt, hopelessness, worthlessness. Those are things we see with depression. Listen, in real life too, when somebody is up here and glued to the roof, we can do what? We can psychopharmacologically or psychotherapeutically pull them back down to this graph line right here. What do we call this line again? We call it, I don't think I told you. This is called the euthymic state. Now, the euthymic state is where we all want to be. Is the happy, jolly state. Life is good. Life is perfect. There are no bumps on the road. There are no bumps on your path. Life is just going smoothly. Nobody stays here. Nobody lives here. However, we need to return here once in a while, though. Does it make sense? And most often than not, we want everybody to be able to return here. Now, if you cannot return to the euthymic states by yourself, that is when we do what? We have to physically give you medication and pull you down here to the midline, or use a talk therapy to pull you down here. Similarly, if you are getting like down and you are down in this dump and you can't rise anymore, we have to pharmacologically pull you up to the good state, or we're going to go ahead and do what? Use words to help you out. But then to know what we're going to do too, that's when our scales comes in. If you're depressed, we're using what? We're using the PHQ-9, for example, to see where you are. If your number is so high on the scale, we're going to send you to, a clinic or something like PHQ-9 of 27. We have to do something about it. We can't just talk you out of that level of depression. If your PHQ-9 is mild, we can definitely do some therapy and get you out of that state over time. Now, let's get back to this question now. So I just feel like I should throw that content in there so it's going to make some sense. So now this patient, based on my little graph right here and my analysis, I'm going to go ahead and label this graph for more clarity. This is getting to a manic phase. This is bipolar 1. Below bipolar 1 is called hypomania. Hypomania is right below the manic phase. Below the hypomania is now the euthymic phase. That is the straight line that we all desire to be. Now, we are not all there, but a lot of times when we get down on the dump or when we get to the top of the roof, we can find our way back up by ourselves. It is only when we cannot get up or come down by ourselves, that is when we need help. That's when they need our Pmhnps, right? Or our therapists or social work and stuff to get us the services and the support that we need. Now, below the euthymic phase, when it's getting down here, that is where we have our depression. Depression, somebody that is down in the dump. Most importantly, you must recognize the symptoms. They will not give you this content on the exam like this. They will not call depression depression. They will describe the symptom and expect you to know it. The only way to know it is to tap into what is up here. The brain is like a computer. You can only tap into what is there. There are no strategies without content. Absolutely none. Dr. Kehinde Elisha speaking here, founder and CEO of MP Certification Academy. To really connect with us and be in our circle, visit www.mpcertificationacademy.com. Don't forget, after you pass your board exam, guess what? We're going to add you to our experts group where you're going to continue to collaborate with other providers like you. We have more than 3,000 members so far that are interested, but our WhatsApp is getting full, so we should be changing our platform soon so that we can have all our providers in there. A lot of people also are not comfortable being in WhatsApp, so we only physically have almost 1,000 right now, so we are getting maxed out in that WhatsApp. The max is supposed to be 1024. So what is my point? My point is you got to be in that circle that when you pass your board exam, you won't just do what? You won't just be by yourself trying to navigate the world. You're going to be with the next phase and then collaborate and network yourself. Not that we do anything special for you. I'm not going to make any promises that I can't fulfill, but you will be in the right circle of people that are progressing. You will be in the right circle of people that are already ahead of you. They have their own clinics and they can also help you navigate if you're interested in their in how they get there. So, and on Thursday night, we also meet every Thursday to help serve our expert community. We go through case studies. They bring their clinical cases. We all brainstorm together and guide you through life. So you are never going to be alone. For our experts, just visit www.confidentprescriber.com. www.confidentprescriber.com. Now, back to this question. What is the final answer? The final answer is what? Bipolar 1 disorder, period. This is getting to a manic phase if you can see it. Bipolar 1 disorder, period. Let's see how to let's look at how we navigate, how we came up to that conclusion. This is how you should be analyzing question on the exam. This is how you should be thinking. Step-by-step analysis. Sleep. No sleep for 6 nights. It is concerning. This is a manic episode. Reduced need for sleep is very, very big. That is the hallmark for bipolar. Mood and behavior, elevated mood, grandiosity. I am God. I know Jesus. I saw Jesus last night, not in my sleep. In real life, I even shook hands with him. I'm going to go meet with the president and so on. Like those are grandiose thoughts, precious speech, impulsive or risky behavior. Functional impairment, like is spending and behavior how clear, functional impairment satisfying DSM-5 tier criteria for mania. What about duration? It's more than a week. That's the main thing. That has to be 7 days. How will I remember that? Bipolar 1. Okay, when you say 1, there is 1 week. 1 week is equal to 7 days. So that will help me remember what? My 7 days. But you have to remember your symptoms. The mnemonic for your symptom is mostly what? Something we call dig fast. Listen, the mnemonic for, depression is going to be what? Psychic apps. Now, rule out other diagnoses though. No depressive episode. Rule out bipolar 2. Make sure there is no psychotic symptoms apart from grandiosity. No schizoaffective. No 2-year duration of ups and downs, not cyclothamia. So you're going to be ruling out other things because these things tend to overlap. Now let's look at the rationale for why we picked A. It's A because what? Bipolar 1 meets DSM-5 tier criteria or manic episode, elevated mood, grandiosity. Again, based on the explanation that we just gave. Bipolar 2 disorder requires hypomanic episode, plus major depressive episode. When I say bipolar 2, 2 poles, that's what I mean. Hypomanic is 1, MDD is 2. That is 2 poles. Bipolar 2, 2 poles, right? Now, cyclothamia requires more than 2 years of fluctuating what? Subthreshold depressive and hypomanic episode or symptoms. This episode is too severe and acute for cyclothamia. What about schizoaffective disorder? There is no persistent delusions or hallucinations for more than 2 weeks. Without mood symptoms, grandiosity alone does not meet psychotic disorder criteria. If you are my regular student, this is not the full review. This is only one diagnosis out of like more than 50 diagnoses that you have to know for tests. So you are in a safe place if you're already enrolled with us. If you have yet to enroll with us, I can't really promise that this is going to be anything. That this is not everything. There's a lot more to learn. Visit www.npcertificationacademy.com. We're not going to stop here right here. I'm now going to throw in some content on critical thinking application of neurobiology, DSM-5-TR, as well as psychopharmacology. Thank you so much, but I'm going to be terminating this right here because it's already at 15 minutes. Have a wonderful day, everybody.